states that you write in. Okay. I specialize in diabetic testing supplies, and my focus is to support you to improve retention and grow your book of business. So before we dive in, just wanted to share a little bit. Last year, we surveyed agents that used ADS. Over 600 agents replied to the survey, and what we learned shocked us. I have gotten new word of mouth referrals due to clients' experience with ADS. Most of them agreed or strongly agreed as to what we are doing here. So our purpose is to help those members out and make the agent look like a rock star in their eyes. 30% of the agents who participated in our survey claim to have gotten new word of mouth referrals due to their clients' positive experience. So instead of an empty promise of what we claim to do, I figured it'd be nice to share what we've already done for others just like you. 30% of agents said they have a bigger book of business thanks to ADS. And now we're going to go into a little bit about who ADS is and who I am and what we do and what our agent support, how our agent support program works and how to take advantage of it now. So ADS is a diabetes supply pharmacy. That's all we do. We are a nationally accredited pharmacy, accredited through multiple organizations. We were founded in 2002, so we have over 20 years of industry expertise in diabetic testing supplies. So when you call us, you are talking to the experts in diabetes. That's all we do. Now, how the agent support program works. You find your clients with diabetes, you send them over to ADS, we call them for you, we set them up for home delivery. We are basically a full service concierge support system for you, the agent. It's that easy. Before I forget, we do this service at no cost to you or your member. We are a pharmacy. We're here to support you and take care of the member. And now let's do a little breakdown of how this all works. So first, finding your clients with diabetes. As you see on these maps from the left all the way to the right, as the blue gets darker, that is the propensity of diabetes on the rise. It's not going away, folks. Unfortunately, they are getting younger and younger. And statistics do show that out of every 3 Medicare.
Hey, Ruiz.
Yes.
We're not seeing her screen at all.
Oh, I'm super sorry. Hold on here. How about now?
Nope. Still nothing.
All right. Hold on here. Lucy, can you stop sharing and then reshare? Maybe it'll kick on.
Yep. Let me see.
Super sorry. I thought you guys were seeing that.
Okay. Now we are.
Perfect. Hey, thank you for letting me know. Sorry about that, Lucy.
Yeah, no worries. It's okay. We can just go through some of these. This is a little bit of what we just discussed. I'm just going to kind of fast forward. We're still good, right? Everybody can see my screen?
We're rocking.
Yes.
Okay, perfect. All right. So a little bit about the ADS. How do we find our members? We are your concierge support and all of this at no cost. And now we're going to see how it breaks down. And this is where we left off. So on those maps, as you see the blue getting darker and darker through the years, that is diabetes on the rise. Out of every 3 Medicare beneficiaries, 1 for sure is a diabetic. And in some areas, it's probably a little bit more than that. And so how do you figure out who does or who is your diabetic client? I tell everybody the secret is ask everyone. Any of your members that you have on your book or any new members that you connect with, you ask them, do you check your blood sugar at home? If they say yes, that's someone we can assist. Remember that 1 in 3 will, and that's who we can call for you. And this is what it looks like. You get your client's permission to send their contact to ADS. We call them. This by far is the most effective way for us to support you. You tell them, I'd like to send your information to ADS. They help my clients who test their sugar. Is it okay if I have them call you to take care of your supplies? They're going to say, yes, that would be great. You're an amazing agent. I'm going to introduce you to all my friends and family so they can help. You can help them with Medicare too. And this does happen all the time. We made this into a fun little caricature thing, but this is true. This is how it works. We try to keep it simple. So what does that call look like? Yes.
Lucy, do you happen to have like a sample text or email template that agents can utilize to plug into their CRMs to send this to clients?
Send this to clients. Well, we don't do the presentation to clients because this is specifically for the agents.
No.
Um,
Just like if you go back to the screen, go
uh-huh.
back, go back where right here, where with their permission, we're
Oh,
telling them about ADS. So what I'm thinking, like I could take all of my Medicare clients and
uh-huh.
then maybe like insert a text or an email that says, "Hey, are you diabetic? If
Uh-huh. Are
so,
you checking your blood sugar? Yeah. Because I think
so
Medicare doesn't allow you to straight up ask, are you a diabetic?
okay, all right.
You know,
Well,
there's certain things that Medicare allows us to ask and not ask. Sometimes it's just based on looking at their medications.
okay. Well,
Yeah.
if you have a template that you might share with us, if, instead of us creating one, that'd be cool.
I mean, I maybe you might want to use something like this. You can ask them, you know, are you checking your blood sugar at home? If you are, this is something I can help you with. You know, that type of thing.
Okay.
Because we try to keep it as simple as possible to avoid any confusion.
Okay, I'm gonna write. Are you checking your blood sugar? Okay, I'll make
Yeah.
something for you guys and then post it out there. I'll create a text and an email.
Yeah, maybe this is right here, the secret. Do you check your blood sugar at home? And then when they start saying, yes, I do, my doctor says I should, uh, these are people that we can definitely service.
Got it. Okay,
Uh-huh.
I've got it. Okay, we're rocking. Thank you.
Yeah, you're welcome. Okay, and so what does this call look like? Our team will call on your behalf, always referencing your name. Hi, Janet. Aaron Smith, your insurance agent, asked me to give you a call to get you set up for home delivery of your diabetic testing supplies. And then ADS always calls from one specific number. It's that 760-827-6243. I always tell agents when you meet with your clients, if you're with them, save that number to their cell. That way they know it's safe to answer when we call because I know that all the agents have trained their members very well in not answering calls they don't recognize. So we want to make sure that they do answer our calls because sometimes it does delay the process. We have to make contact with them. And when we can't, you know, it just delays everything. So if we can't get a hold of them, I'm going to reach out to you, the agent, and say, hey, we've already called 4 or 5 times. We've sent a text. We're sending a letter. Can you get a hold of them for us? Let them know we're trying to reach out. So I always say, please save that number or tell them we're going to call from that 760 area code.
Perfect. Hey, Lucy, we've got a good
Yeah.
question here. Is
Uh-huh.
this for people who are on Medicare only, or can we use it for people under 65 with an ACA plan?
Thank you. Yes, we are open to ACA now.
Ah, yes.
Yeah. So we're not only a Medicare pharmacy, we are open to ACA. Now, I have learned that ACA plans are all a little bit different based on income. So some deductibles are different than others. Copays can be different. And so we handle them case by case. We do quote them a copay if there is one. If they can afford it, great. If they can't, well, we tried.
Okay.
That's all we can do with the ACA plans. I've had a
Okay.
lot of luck with the Ambetter plans. I'm not sure which ones you guys are writing, but with all our national contracts, as long as the IFP program or product is part of it, we're able to service them.
Great. Yeah, Ambitter's
Okay.
pretty popular. They're a
Yeah.
strong carrier. We're looking now, and of course, there's United, there's Aetna, Oscar,
Uh-huh.
Health, numerous ones out there.
Right. And we will check all of them. We'll run, you know, the claim to see what comes back, and then we'll let the member know. We always check in with the member before we ship, of course.
Perfect.
All
Thank
right.
you.
So what happens next? When you refer the member and we've talked to them, we're going to fax the prescription over to the doctor's office. If there's a pre-authorization required, we will do that. We verify and bill their insurance properly, and then we ship their supplies directly to their home or their PO box, wherever they want us to. As long as they're in the United States, it's free of charge. We ship them their supplies. Usually they get 3 months worth of supplies, and they will get a call from us every 3 months to remind them it's time for a refill. So we make sure that they're not running out of supplies at all. They're always well taken care of. All right, so now let's take a look at the type of hardware that ADS carries. And this is going to be a lot of information. You really don't have to remember all of these items. This is our wheelhouse. All you need to know is that anything diabetes or supplies, you're still going to win big having us take care of your members for you. So the basics. Now, I put these two meters here because these tend to be the two most common formulary meters that are covered through the insurance plans. There are many others. We carry all kinds, but we put these two because these tend to be the most popular. These are the glucometers. A total kit includes a meter, the test strips, the lancets, the lancing device, and the control solution. These are covered by Medicare Part B, and this is almost always zero copay for the Medicare beneficiaries. This is exactly what Luis was talking about earlier. I get calls all the time from agents saying my member went to the local pharmacy, they got charged a copay for their supplies, and that's because pharmacies are very busy. They're not specializing in one thing like we do, and they're giving them whatever's on the shelf. It may not be a formulary meter. There's the copay. And now every month that they go back to get the strips to go with the meter because they have to match, there's another copay. They're paying 40, 60, even $120 for strips when they should not be paying anything. So we want to make sure from the get-go that none of this happens. They're being taken care of right away. You don't want them calling you upset. You don't want them disenrolling. We want to make sure that they're taken care of correctly from the get-go. So all clients with diabetes qualify for this type of product. And now we go into the very popular continuous glucose monitors.
And Lucy, I want to add something
Yes.
about the money here, guys. You know, we know that our seniors are typically on a super tight budget, guys. So if you could free up some of that money for them, think about what you can do with some of that money that's freed up. It's not cheap getting you supplies from a pharmacy. Lucy, you have any like numbers on what some of this stuff may cost them at maybe a CVS or Walgreens?
Yeah, I've been told that they were charged 40, 60, and $80 as a copay just to get the meter. And then every month they're going back to buy the strips and it's costing them money. So that should have never happened from the start.
So think about that money. Let's just go on the low end, guys, and it's $40. That's some really good final expense money that you could utilize for a policy.
Yep. Just about anything else. We need to help them out so they don't have to come out of pocket for these supplies, especially when they're covered, right? All right, so now we've got the popular continuous glucose monitors. On the left, you've got the Freestyle Libre, and on the right, you've got the Dexcom. These are the two most popular on the market. People are really wanting these devices. You're going to have members that tell you, I am tired of poking my fingers. I've been doing it for 25 years. I don't want to do it anymore. If you promise me that I can get this, I'll sign with you. So just remember, beware. Yes, all plans cover these devices, and it is amazing technology for diabetic management. And Medicare costs can range from 0 to 20%, depending on the plan. The 20% could be approximately $50 a month, again, depending on the plan. But now, although it is covered through the plan, the member must be eligible. What are the requirements? The CMS guidelines are that your member must be injecting insulin at least one time a day. And remember, it's insulin one time a day, not the Ozempic once a week. That's not true insulin. They must be on true insulin, or the opposite is they have to have a history of hypoglycemic events, meaning that their blood sugar drops below 54. So just remember with diabetes, they have to be within a certain range. Very low is very dangerous. Too high is very dangerous. And so the purpose of these glucose monitors is to show that the doctor is working with the patient to try to control their diabetes. So again, those members that are taking oral medications are not eligible. I tell them the good news is you're not sick enough for this device because these devices are designed for members that their diabetes is advanced. They're either too low or too high, and the doctor's working with them. So they must be, again, on insulin daily, even if it's one time a day, or their blood sugar has dropped below 54. Now, if you talk to them about that hypoglycemic event, what does it mean? Most members are going to tell you a story of how unpleasant it was. I always share, my dad was a diabetic. He used to spend hours working and sometimes forget to eat. And I'd find him sitting in a corner, pale, shivering, and sweating at the same time. That's blood sugar dropping really, really low. And it's very dangerous. So, and sometimes people are hospitalized. Believe me, when a member tells you their sugar has dropped below 54, they know when it's happened and they'll tell you stories about what happened. So again, if they're on insulin, we can service that device. If they're not on insulin, they have to have a history of their blood sugar dropping. And if it's neither, we can still service them with a meter and strips because they still have to check their blood sugar. All right, what else do we service? We service insulin pumps and the supplies. These are all Part B items. Medtronic and Tandem pumps. They have the reservoir and cartridges. They hold the insulin. The infusion sets are the tubes that deliver the insulin. Expect about a 20% Part B coinsurance, which is approximately anywhere between 30 and 50 bucks a month. Insulin for this pump is covered under Part B. This is the one and only time that insulin does go under Part B because Medicare says that if you are on a pump, then the insulin must go with the pump. So this is the one and only time that insulin is billed under that Part B. Part D items. We have another insulin delivery system, which is the Omnipod.
Lucy, can you go right back, please?
Uh-huh.
The insulin for these pumps, because I also have an individual that uses it. The insulin is also delivered to them, even though it has to be refrigerated?
Oh, yeah. Yeah. So we don't service the insulin unless they are an actual traditional Medicare member patient. But yes, insurance carriers that deliver the insulin deliver it refrigerated.
Okay.
It's cold. Yeah.
Mhm.
They make sure it's delivered correctly. Yeah. Okay. So Omnipod is another very popular insulin delivery system. The only reason this is a Part D item is because this is disposable. So that's the one and only insulin delivery system that is considered a Part D. The others, which are your insulin syringes and the alcohol wipes or the pen needles, these are all considered ancillaries. These are Part D items. They usually will carry some sort of copay. If they have a supplement that covers the Part D, we're good to go. If they don't, we might be able to help them with our assistance program based on their income. So we might be able to make copays go away if they are eligible. Okay, so that's a lot of info. Let's step back for a minute and remind ourselves of the big picture. You have clients with diabetes. We call them for you. We make you look great, and we send them to diabetic testing supplies. We do this at no cost to help your business grow. And so here's what some of the agents have to say about our services. I'm going to allow you to read some of these. These were all emailed or letters sent to us thanking us for our services. My favorite is the bottom one, which basically shows who I am. It says, I appreciate having the access to an expert on all things related to diabetes supplies. I find this confusing at times, but I know who to call when I need help, and having direct access via phone, text, or email is invaluable. I'm that person. I like to answer and respond right away. You can call me, text me. I always say, send me smoke signals. I will reach out and connect with you and help you out with those members or any of those questions. I'm happy to help. So in case you're still on the fence, last year alone, over 6,000 agents nationwide chose to use ADS services for their clients. And we are the industry gold standard. So we're pretty excited about that. So how do you get started with me today? How do you take advantage for agents that are new to ADS if we've never worked together and you want to get this value right away? I recommend for all your new enrollments, begin asking your clients, do they check their blood sugar at home? Review your last 3 or 6 months of enrollments for clients with diabetes. We can start supporting them right away. My QR code is there. That is a simple, secure form that comes directly to me and our intake department. And we will input your members' information and reach out right away on your behalf. This is my contact information. That's my cell phone number and my email. For any of you, again, that if we don't know each other, please send me a text right now. Give me your name, first and last name, and an email, and then I'll connect with you and send you an email. And I'm also happy to assist with any kind of marketing materials. If you guys are doing any events, tables, I can send you some flyers and help you out with those members. And with that,
Lucy, two things, Lucy, I'm going to ask you. ¿Hablas español, verdad?
Claro que sí, hablo español también.
Okay, so some of you Spanish-speaking agents, Lucy speaks Spanish. And Lucy, does it matter where they are in the U.S.? Do they come to you, or do they get assigned to a local rep?
So we have several reps in my department because the United States is really, really large. For me, I've got California, Texas, and Florida. We have reps that represent other areas. So any of your team here that is sitting in another state other than Texas, um, I can connect you with your rep. But the way it works for us is that if you are, I have a lot of agents that write different states. So if you're sitting in my territory, I am your rep. If you're not sitting in my territory, I will find you your rep or introduce you to them. We're happy to help.
Awesome. Lucy, are you guys doing, well, I'm going to see if you've answered this question.
Okay.
So, Libre,
Yes.
is there a copay for this?
Depends on the plan. Some of them are covered at 100%. Some of your chronic plans do cover it. Some of the other ones are 80/20. 20% would be approximately $50.
Okay, got it.
That's after their Part B deductible has been met.
Which is 100 and what, 180?
I think it's a little more. I think it's 250.
No, 250 something, 260.
Yeah.
Somewhere in that part. Gotcha.
Correct.
Gotcha.
Yeah.
And then when some of these agents do events, do you still provide like maybe a starter kit, like a board with some supplies, or just the flyers?
I have flyers, we have bags, we have pens, I have magnets that go on the refrigerator with our phone number on it, so that the members can put that on their fridge. If they need anything, the number's there so they can reach out to us. We just got bought out by Cardinal Health. And so there's going to be a lot of changes. The good news is they've got very deep pockets, and I'm sure our marketing materials are going to grow as far as the gimmies. But yes, I can help out with that. If you have agents that are very busy and even need a couple of kits, I can send those out as a courtesy so that when you sign somebody up, if they need a kit right now, you can hand that to them. All we ask is that you would refer them over to us so we can take care of them on their supplies.
You got to take care of the hand that feeds you. One, understood. And then I think what would be cool, Lucy, and maybe you can push this up. When I had a table, and I remember it was some company, they had like a board, and it would stand up maybe about 2 feet on the table, and it had some of the devices on there, and it was like a conversation starter. Hey, I want to get one of those. Well, come on, sit down, and then the conversation would start.
Right. So here's what I do have is our flyers do have pictures of these devices, so people will recognize them. Or I could even send you, we don't have samples of like the Libre or the Dexcom, but what I do have is a box that, where the items are in. It's like a demo that I can actually send the box so you can put it on the table so people can say, oh, this is what the Libre looks like, or, oh, this is what the Dexcom looks like. So those are, I can send like a demo box so they can put that on the table. I do that sometimes for the events. Those boxes always seem to walk away from my table too.
Yeah, no, super cool. Yeah, I know. You're like, look at the wrong way. Oop, it's gone.
What happened to my demo? It's gone. Okay, whoever took it, enjoy it.
Damn agents. I'm telling you about us agents. You got to be careful, Lucy.
You're quick.
It may be gone too.
All you got to do is ask and we'll send it.
So if you guys are doing events, guys, and you're out there and you'd like to get some goodies there from Lucy, hit her up. She's got her cell. She's got her email. You can use that QR code underneath her picture. Connect with her. Here's what I would like for y'all to do. Unmute yourselves or just type away. But let's ask some questions of Lucy. Hit her up. Don't be shy, guys.
One of the first questions, and I'll even put this out there that somebody may be asking, is who are the carriers we work with? Because that's always important. So we are Medicare. So we traditional Medicare supplements, Medicare Advantage plans, United Healthcare, Aetna, Cigna. We have a new Humana PPO plan that we can service. Only the Humana PPOs for Libre and Dexcom. That's all I can service right now. It's a small contract, but at least we're finally making headway. Right. Let's see, WellCare. Those are like all the major carriers we can service. I know that in some territories or some areas of Texas, there's small regional plans. We'll probably be able to service those as well. We can always run the claim and see what comes back. If for any reason we cannot service any of your members, we will let them know right away and tell them, we direct them to go to the back of their insurance card and call that pharmacy number and ask them, who is my in-network provider so I can get my supplies. So we will instruct them to do that. And then I'll always let the agent know, thank you for referring Mr. Smith. We weren't able to help him for whatever reason. We're not in network with the plan, but he's got instructions on how to get his supplies. So we will do that.
Perfect.
So most of the major carriers.
Questions, guys, hit her up. Sometimes my people get a little shy.
WellPoint, yes. Devoted, and Alignment, no. Devoted, we don't have a contract with them yet. Irene Chavarria just asked, what about WellPoint, Devoted, and Alignment?
How about Scan? They're
No,
newer.
no, we're not
Nope.
servicing Scan. We've been attempting, even in California for the longest time. No, we don't have a contract with them. We're out of network, not in network.
Yeah, I think the easiest thing to do, guys, is just refer it. Let them say no. Hey, we can't help you, and then they'll take care of push them back, and that way
Yeah.
you're not worried about.
Luis, how about Humana?
Yes, Humana PPO for Libre and Dexcom.
Oh, awesome. Thank you.
Yeah, thank you.
Yeah, not the HMO, Irene. For Humana, all the other ones, yes. Great. Well, cool. All
Thank you.
right. Well, Lucy, we finally connected. Hey, thank you for coming in and sharing some of what you guys do. I'm going to come up with a text email that you can embed. Here's what I'm doing, guys. I already have a nurturing campaign that hits all of my clients that I enroll during AEP. It hits them 8 times a year, 1 time a month. Hey, this is what's going on. So I am going to create a new workflow that adds this to it. And I just got to come up with the wording. And Lucy, for them to sign up, is there a consumer QR code or a consumer something easy that I can copy and paste that you may have?
For the agent to refer the member, it's the QR
Yes.
code. It's a simple, basic form. It really only takes 1 minute. I got to tell you, it is really so important because we have those very busy times of the year. I get text messages literally all day long, and I don't want anything falling through the cracks. It's best. And I also wanted to respond to John Helm here. He asked a question, but it's really the best way to refer. This way, it doesn't fall through the cracks. Number one. Number two, I want to know who referred for various reasons. Number one, I like to say thank you for referring, but also, during the year, members start asking questions about their plans. They want to make changes. And if I don't know who the agent is, I'm going to tell them, I'm sorry, speak to your local agent. But if I know that Luis Moreno referred him, I'm going to say, your insurance agent is Luis Moreno. Here's his number. He's the one who set you up with your insurance. He's going to answer those questions for you. So I want to make sure that everybody knows that we are Medicare. We follow guidelines. We never mess around with who referred or switch. Don't ever be afraid of losing your clients to being transferred to somebody else. And we don't market to them either. We are here to provide a service, and that's it. So the QR code or the link, I can either text it to you or it's in all my emails underneath my signature. You click on that button and it's just basic information, name, date of birth, phone number. And if you have a little information on them, like their address or their insurance plan, or maybe it's not in effect yet, you can always put a note in there, effective May 1st, effective June 1st, whatever, we can still service them. Which leads me to the question that John asked. He said, what's the advantage to the senior to use you as opposed to the network on the back of their MAPD plan? So that's a great question. And here's the advantage. There are a lot of things that we do as a pharmacy to support your members that most pharmacies don't. We will send them courtesy supplies right now if they need something. Pharmacies don't do that. We will help them with copays. Pharmacies don't do that. We are providing them a high level of service and making sure that they are well taken care of. Not, sorry, come back whenever you've got the right information for me. So there's a lot of things that we do for the members to keep them well taken care of and happy, as opposed to just shooing them away until they have all their ducks in a row, so to speak. So there are a lot of things that we do for the members that most pharmacies don't do. And that's the advantage.
And here's the other deal, John. When they're calling the provider, which is ADS, if they got questions, it's gonna come back to you. So that's kind of a nice thing to also have.
Yeah, we stay in contact with the member all along during the process because as soon as we connect with them, we're going to send the prescription to the doctor's office. We're going to follow up on that prescription. A lot of times people ask how long before they can get their supplies. That's the $1 million question because sometimes it's all based on how quickly we can get that prescription from the doctor's office. We do have delays sometimes. Doctors will go in circles. They didn't get it, or they sent one without a signature. We cannot supply the member until we've got that prescription in order. Better said, we cannot bill the insurance until that prescription is in order. So in the meantime, we are doing what it takes by sending courtesy supplies until we get that prescription to make sure that the patient isn't, or the member isn't, not testing their blood sugar just because we're waiting on a prescription. So we're going to make sure that they're taken care of. And then once we get the prescription and all, we will let them know. We keep them engaged through the process. We got the prescription. We're checking your insurance. We should be shipping, and we always have to get an okay to ship as well. So we don't nilly-willy ship.
Good questions. Thank you guys for asking. Appreciate that. Keeps it interesting for me. All right. Well, awesome. Hey, Lucy, thank you. I appreciate it.
Thank you all for being here.
Yeah. I just hit the QR code to look at it on my phone, and you're right. You just got to put the client's name, date of birth, phone number, their language, and their address, some doctor's information, their MBI number, Medicaid number if you have one, plan ID, and roll with it.
All of that information helps if you do have it, because a lot of the members, especially the elderly ones, have a difficult time finding their cards. They can't see the numbers. If you could just take a minute and give me that information would be a great help. If you don't have the time, send me the patient's basic information, and then we'll reach out to them and get it. And if there's any reason that I need to reach out to you for more information, then I will. So that's really the best way. It is. It's a very quick way of referring the member, and we can reach out. The other thing is, sometimes I do tend to travel a lot. So there's times that you're calling me and saying, hey, I have a member for you. Please call me. It might take me a day or two to respond. I'd rather you just send that form in and we can reach out right away and start getting them taken care of. So I don't want to have any delays in taking care of the members. In that form too, where it says you can toggle between Medicare or ACA, the language, and then there's also a space there for any notes. Sometimes members have a point of contact, talk to the niece, talk to the daughter. She takes care of all the information. So you can put a little note in there of whatever we need to know. Or if the plan is not in effect yet, it will be in effect. Great. There's no plan number or no member ID number, but we know that it will be in effect. And we'll get the paper rolling anyway, get the prescription signed and all that, so that once that plan is in effect, everything is in place and we can send out their supplies as soon as the plan is in effect.
Easy peasy.
Easy peasy. Lots of information. Feel free to call me or text me, guys. Please, if you haven't texted me, send me your info. And then maybe, Luis, if I could have everybody's permission, perhaps you can send me a list of your agents that did attend so I can reach out to them and make sure that we're connected. Again, we don't market and we don't bug.
I don't get the email to require it, so I don't have a list. I need to start doing that. I need to figure out how to do it on Zoom to get people to give me their email. So I'll work on that for you. But guys, if you would, send Lucy an email, get set up, that way she can connect with you.
Yeah, very good.
Okay, there you go. So we got a few that want, let's see here. We do have a question. I just saw it. Let's see here. I'd like a demo. Okay, good. No, I think, So Irene, she does a Walmart. So definitely connect with her, Irene. She can help us out since you're in El Paso.
And then Paul, if you don't mind, send me either an email or a text with your information. I see your email there, but I don't have a phone number. So this way I can reach out to you.
Hit her up.
My cell phone number is there on the screen in yellow.
Yeah, hit her up. Niquit, is that right?
Nikkei. It's Nikkei.
Nikkei at northcoastmed.com.
Yep.
Irene, hit her up, Irene, please. Email her. That way you're connecting directly with her, please.
Yeah, because as soon as we're done here, all this information from the chat will be gone.
Yeah, it will be. All right. Okay, Irene. Okay. Lucy, thank you again. I appreciate you.
Thank you. Thanks for having me. Come on, Luis. It's always a pleasure. All right. Bye-bye. You guys have a good day. Good luck. Okay, thanks. Bye-bye. Bye-bye.